Hey, it's Dr. Pierce from Michigan Sports and Spine. I've lost track of what week it is. We're in the 20s. But huge news, and big shout out to Nicole. We broke 1,000 viewers last week. So that's a huge deal. That is actually motivating for me today to bring what she's saying. I need high energy. Also, Paige, my daughter, always says, bring it. You got to bring it if I'm going to listen. So we're going to try to bring it today. It's an absolute beautiful day outside. I did not want to do this. We should really be doing this from outside. I mean, sunny and 70 on October 7th. We're all thankful for that in Michigan. But, I mean, big news, not that we want to talk about, but with Trump being in the hospital and COVID and Nicole's giving me the eyes, don't start bringing that up. We have to address it. I mean, it's more of the medicals, more of the prevention, things we keep pushing for every week, and that's my message. I don't want to be political. I don't want to be anything like that. I just want to promote you that you have to be positive. You have to be finding a prevention, finding, again, sleep-wake cycles. You need to sleep properly. You need to eat properly. The nutrition needs to be proper. That's the way you're going to, if we do catch it. Unfortunately, they say everybody at some point is going to catch it, and we want to push for you to be the healthiest person you can be to fight any type of infection. And forget about COVID. We're talking about flu season. With flu season alone, you should be pushing for this very big. And that's the other thing. We're definitely moving into IV therapy. Michigan Sports and Spine is going to be moving into IV therapy. We have great partners out there with Carrie Toposian up in Bloomfield. We're now trying to team up with the group out of Royal Oak. They're having great success. We're looking to team up with those individuals to bring our specialty along with their specialty, so we can bring a better product to the consumer or yourself, whatever we want to call you. But to be honest, I mean, you need to be the best you can be. This whole thing about sitting at home and laying in bed and eating properly, you're putting yourself more at risk just to catch something that you're not going to be able to deal with. COVID is it's a reminder that this is a severe disease that we need to put up every defense mechanism to battle it. So I'm not going to keep going off on that. We have a lot of questions today. I have my new doctor here, Dr. Khan. She's here listening. She's the new fellow. She left her practice in Chicago to come train with us, which is really honestly a big honor for us, that she feels that we have something to teach her. She's followed what we've done here for a while. She's actually looked at our place 6 years ago. 6 years ago. Said maybe I'm not ready, and now she's on to her next chapter of life, and hopefully we can help her through that. But again, a big welcome to her, to the practice. For individuals that are coming, you're definitely going to meet her. She's very sweet. She's much nicer than me. You'll probably be able to talk to her a lot easier and longer than I will. But I may ask her some of these questions when I get stuck, so she better be on her toes for right now. Basically, question one is cervical nerve pain. So cervical, again, is neck. Is normal that it radiates from one side to the other. Why does cervical neck pain radiate to the fingers and the forearm, making it hard for me to do anything with that side? So again, with the nerve, where's my little spine here? So what goes on with these spines? I've talked about this a lot. I've shown my little image. We know my skeleton's behind me that Nicole continues to hide. But this is the bone, this is the disc, these are the nerves. So when we talk about radiating pain down the arm, that's what all these little outlets are, all these outlet nerve roots. So there's the big spinal cord in the middle here, which goes down through the spine, and then you have these outlets. When these outlets are pinched or herniated, or whatever word we want to use, it's compromised to some degree, this is what innervates all the way down to your hand. And sometimes when it's just irritating, it can cause a little numbness or tingling. When it's really pinched, you start losing muscle control. You lose the muscle part of it. So there's the sensation and there's the muscle part. So when you're asking, why do my fingers, my forearms hurt? That's why. It's called a referred pain. It's a radiating pain because these nerves in your neck are being pinched. There's other nerves in your arm that can be pinched also, like we know all about carpal tunnel. We know about the median nerve through the wrist. That's different. So a lot of times when we see patients that are having neck pain and arm pain, we usually have to rule out that there's no impingement or compromise of the nerves, mostly at the wrist and at the elbow, but also into the armpit. So there's four major areas where the nerve can be pinched to cause that referred pain. the number one, like I've always talked about, if you've been listening, I always want to know what the primary pain generator is. So we always try to go as far up as possible. So if it's the neck that's causing it, and then there's irritation in the nerves around the elbow or around the wrist or in your armpit, then that's the problem. Sometimes it is local, like carpal tunnel, where it's just to the wrist, where you have a problem here, where this nerve runs with all these other ligaments in this small little canal, which anatomically we say was not designed appropriately, and we have problems. So when you get overuse, or the biggest thing is computer use, or texting now is causing it, you're having a problem with that nerve. Around the elbow is a little less common, but also very common, where you feel like you hit your funny bone, you get a little zing down the arm. That's the ulnar nerve, which gets compressed. A lot of pitchers, a lot of throwing athletes can get irritation to that nerve, which is a problem. And then up in the armpit, sometimes, unfortunately, it's first signs of things with tumors or big cysts or adipose tissue can compromise those areas. So everything has to be examined to make sure it is coming from the neck or it is coming distally. You have to see someone who's a specialist. Like I've said multiple times, it's not necessarily your primary care doctor. He's got other tools. When you talk about specialists, no matter what the field is, if it's endocrine, if it's related to diabetes, go to the physician that has the right tools to make the right diagnosis, because in today's medical world, you don't get too many second chances. So you want to get the proper diagnosis, and it's probably worth the wait to see a specialist to get in as quick as possible. So hopefully that answers your question. The cervical pain, again, it's not normal. That's not normal to have it radiating down the arm. That's the red flag where you need to be seen. If you can't if it doesn't go away in 72 hours, you need to be seen by a physician so it doesn't get worse. My basic example that I tell patients, if you have a little snowball at the top of the hill, you can beat it up and break it up at the beginning. If you let it roll partly down that hill, it's now getting bigger and stronger, and you need to use more aggressive tools to solve it. So, being proactive and preventative is the major key to that. So the next question comes from over the border. Unfortunately, Canada can't come to the States these days, but this is one of our patients or potential patients in Windsor. It's a long question. I'm not going to read it all, but basically it says, I'm wondering if you think I could benefit from PRP or possibly stem cell injections. I have cervical osteoarthritis and do I know of any patients that were successfully treated with PRP and stem cell? So basically, absolutely. We've treated a handful of patients. Probably one of my biggest ones was from Toronto. He was an athlete. He was a hockey player and golfer. So he came over because there is limitations what they can get in Canada. It's not as bad as it used to be. This is a couple of years ago. So there are more individuals doing it over there. Are they doing it differently? It's not like when I say it's over in Europe, in Mexico, where they have different techniques and different abilities because they don't have the FDA regulating it the same way they do here. So they have actually a more aggressive form of doing the PRP and stem cell. But for here, absolutely. When we talk about osteoarthritis, there's multiple things going on. Sometimes it's the arthritis irritates the ligaments, it irritates the nerve, it irritates the disc. The problem is if it's true osteoarthritis where there's a bony change. So again, getting back to my friendly spine, if these openings become compromised because of bone, it's not going to improve from PRP and stem cell. What we're going to do, we can't open it up. The only way to open it up is through surgery, opening it up through some type of minimally invasive surgery. What you want to do, what we do, is we strengthen the ligaments. So like on osteoarthritis, you have laxity, so you have more movement in the spine sometimes, which can cause discomfort. You have areas where there's all these things are covered with small ligaments, small muscles, and nerves. We'll go after this area and the joint. We'll bathe that joint we'll get what we call regenerative properties from it. So absolutely, the thing we can't do is change the bony structure. We can improve everything else around it. So I don't know if you've heard my talks before, but basically what we're trying to do is we're using the steroid injection to calm the pain down. So we're getting the PRP and the stem cell to actually be more productive, have more abilities, that it's not just trying to reduce the discomfort. It's actually, I would rather reduce the comfort with the pain injections and then come in with the PRP where we actually get growth, regeneration, hopefully. So yeah, we would definitely be able to see you. I definitely need some imaging done and an examination to give you a true idea if it would be beneficial. I don't want to say your age, but you're at that borderline age where we would like to, depends how healthy you are. If you're a healthy individual, your age won't matter in this case. But some people that are a little bit older and aged, then sometimes we talk about the pros and cons of using your own stem cell. So ideally, just on stem cell, we harvest from you. We harvest from your bone marrow in your iliac crest in your hip, and usually, they say after 50 it starts to taper off the stem cell. If you're healthy and you're an active individual, most of the times that's not the case until you're about 80 years old. So we kind of play with that depending on patient specific. All right, so question 3. How am I doing so far, Dr. Khan? I do all right with that last one? It was long-winded. Anyhow, so question 3. A few days ago, I started using essential oils and some of their supplements. They are natural products called, I'm not going to mention the name. I was wondering if I have knowledge or an opinion on such products. So I don't group this into any, all holistic medicine, but it kind of does fall into it. To be honest, I've used it more. I use it on my own. I actually have some right here that I've been using. I won't show the name of it either. But we're not promoting. We do have someone we work with closely for essential oils that I have a lot of confidence in. It's Arlene Redmond. She's been a great asset to our business for taking care of individuals that are interested in that. And for those that want to learn more, because there is a very good component of healing. Again, it's not one tool, it's the combination of tools that we need to use. Essential oils, and if you respond to that, and I always put out that's the lavender. The only one I know is lavender. But I know there's so many more, and I don't want to talk about it because I won't sound that intelligent. But basically, they're all very beneficial. And it depends on what's going on. It depends what your sensitivities are. It depends what you're trying to accomplish. Are you trying to sleep better? Is it that you have congestion in your ears? Do you want to have clearer thoughts? Is it soreness in your neck? So there's all these other things we need to understand before we start prescribing. So the simple answer is yes. We absolutely use essential oils. I do promote it. We're definitely pushing more to non-medication, non-narcotics, and this is one of the tools we have found that have been beneficial with a lot of patients. You have to be open-minded. For a patient that just wants pure medication, we're not always the right place to be. You have to be open-minded that there's other use of tools. And again, when I told you we built a virtual team through the pandemic, that's what we've all done. We're all very knowledgeable. I feel all my virtual team is top in their field, understanding the true medicine, but they have the abilities to be open-minded to things outside of that. When something doesn't automatically fit into the box, we got to be able to understand and treat you better. Right now I have my fellow here, I have a medical student here. I'm trying to be, teach them that don't just always think the patient's here. Patients aren't here, they got better things to do. When they're here, we can't figure it out, it's on us to figure it out. We're the ones failing, it's not them. We do have some patients that have some other issues that we need to deal with, and everybody's going through a little extra stress, and we have to decipher which is, for medical, for emotional, and all that. But it's on us to be better at treating you. And when I figure it out, it's on you to follow through with what we actually ask you to do. So it's a team approach here. It's not like, oh, take this pill. It's the last thing. I just had a major discussion with one of my close friends. It's actually a patient that it's not always about a pill. There are certain doctors out there, and they're supposedly very famous doctors, but a pill isn't the answer. Sometimes you need to take a step back and look at it from what we call the holistic approach. Holistic approach is like a new term. I've been using it since I started 20 plus years ago. We've used it to the nth degree. I'm very pro, non-medication. It's not that we don't use them. We don't want you to become dependent on it. There's medications that you need for blood pressure and stuff like that. In our field, it's a very short time you should need it. And pain medications is a whole other topic that when somebody asks me a question, I'll get into it. But for right now, yes, we will use the essential oils. We'll use the IV therapy, which I mentioned earlier. IV therapy, I think, is great right now. I think it's not very harmful. It's called Curewell House in Royal Oak. They've done a great job over the last 3 years. They've perfected what they're doing. We're looking to actually team up with them again. at least as a virtual team member, if not a true team member. But I think they have a great product out there. One of my good friends actually turned us on to them, and Nicole's actually knows people that go there. So shout out to them. Question 4. You answered my question last week regarding my 24/7 spine pain. I've been messaging with you about possibly making an appointment. How many locations do you have? Really, this is one of our questions. Okay, this is an easy one. She wanted me to have a short one, so we're done earlier.
No, Troy patient.
We have 2 locations. Well, actually, we have 3 locations. We have our Livonia location at 6.5 in Middlebelt, which is, you know, our little boutique shop. Then we have our big office in Troy over the Troy Sports Center. But unfortunately, they just opened up a couple weeks ago, and we haven't been back in there yet. So hopefully we'll be back in there soon. And then we have with Dr. Abrahamson and Dr. Bonnet starting down there, we have our Wyandotte location. But we also have our surgery center in Westland. So we have we're pretty spread out. We're not in Flint. I just had somebody from Milo, Michigan, 3 hours away, came in to see us. So we have a far reach. Hopefully we have enough people in the state and actually from Ohio and Canada, but we start seeing those individuals also, and we create a treatment plan. So a lot of times we talk about my protocols. Most of the people we send you to usually understands our protocols from a therapy standpoint. We have a very different approach. With our telemedicine, we're touching everybody from California to Florida to New York. We've had a handful of people do that. As everybody knows, I do a lot with the entertainers. So I've met trainers and therapists around the country that are now sending some of their patients to us because of the telemedicine. So we love that. We love to be able to help. Hopefully we are being beneficial to them. But for you locally, I mean, we're available with Dr. Bonnet here now, who's actually getting his rhythm. Dr. Khan started this week. So that actually gets to free me up to start doing a little bit more and starting to talk with more individuals. So we're taking appointments now. Everything's great. We're doing telemedicine. We're doing in-house. We're doing injections. We're pretty much running, you know, we have a new system with the new pandemic. Everybody's got the new normal. We have our new normal. And we have a great staff to provide care for you. So don't hesitate to call. We want you to call. Have your family call. Whoever it is. This is my little plug that Nicole's saying I need to do. I hate doing this, but no, they're great young doctors, and they inspire me. They're bringing energy to me. Like I said, I love doing the stem cell, the PRP. Dr. Bonnet loves headaches, and he's already done injections where I'm already seeing he knows what he's talking about, so that's great. And Dr. Abrahamson's another rock star that's part of the team there, so we're really happy with that. So question 5, I don't have Facebook. I feel like Really?
Yeah.
I feel like I'm left out from your show. Well, you know, we've gone global now. We're not just on Facebook anymore. We're on YouTube. We're on YouTube. We're on Instagram. You can subscribe to our YouTube channel, which we're starting. We're trying to build it. Again, you know, we're kind of pushing to social media. Some of you may know that know me for years. I was on 97.1 The Ticket through Sports Medicine. Sports Talk Radio. We did the Sports Medicine show. So this is me coming into the new age that I don't need the radio, that we're going to be able to do it here right from my office at more on my terms. But no, we're here. I feel bad if you're not on Facebook. I know everybody's allowed to get their own Facebook. We'd love to encourage. I'm sure Facebook would love a new member because they want to watch our show. But no, we're on YouTube. We're on, actually, if you go to our email hosts it live every, like right after this. So you can actually, if you're, you know, the show's usually 3:30 to around 4, and it's uploaded within what, an hour?
1 minute.
With a minute. So by 4 o'clock you can actually catch this show. And to be honest, we are trying to get, I know there's a lot of questions and comments going on right now. We're trying to open it up where we can actually go live with the comments. But to be honest, I did that on the radio, and it was fun, but we had an hour, and Nicole says I talk too long. So we're trying to keep it to questions, and then we can vent the questions and get them up for the next week. If it's something that you need urgently, you can always call and come in and see us. But overall, yeah, like I said, we're in our 22nd week. We're happy with what's going. big milestone that we broke 1,000 viewers last week. We'd like to do better this week. We want to continue growing to motivate. And, I honestly do a shout out to all your friends if this is really beneficial. If it's not, send me your recommendations, what you'd like to hear about, what you'd like to see. I know friends of mine have said the lighting's a little bit off here, and I'm maybe not smiling all the time, but I try to bring the energy. So overall, our big message overall, radiating pain is a red flag. So we talked about the neck. It's everywhere. It's in your neck. It can be in your mid-back. It could be in your lower spine. It's your lumbar region, which is the lumbar, 5 segments below. If it's radiating down your legs, those are all red flags. Those are things you can't ignore. Those things don't go away on their own, typically. I mean, if it lasts, like I said, more than 72 hours, you need to be in and see someone. A lot of people see chiropractors, that's fine. But with the nerve pain, I really like you to see someone with a specialty like what we do. Sports medicine rehab is probably number one for that field. If you feel that it's so bad that you need a surgeon, a lot of times, even with the insurances, I don't know, like I said, we're the specialists for Priority Health, BCN, and HAP. That we're the gatekeepers. We're the ones you need to see before you can see a surgeon, and that's not just by accident. That's saying that a high 90% do not need surgery. So the non-surgical approach is really the way to go, both for your neck, for majority of your injuries. Even when I was doing full sports medicine for the professionals, majority of the stuff is non-surgical. Even when you hear about all these injuries with football starting again, they're not going for surgery. It's a rehab program. It's injections. It may be a little bit of a scope once in a while, but overall, you're not seeing major surgery for majority of the injuries. So it's very important to go to the right type of doctor. My big message today, if it's me or whatever it is, if it's your sugars, if it's diabetes, if it's blood pressure, you need to go to doctors that are comfortable with it. If it's urology, if it's ophthalmology, if it's your eyes, you need to go to the right treating physician. So that's the other big message. The use of non-surgical, non-narcotic approach, we're all about it. I feel we're a leader in that in this community of a non-surgical, non-narcotic approach. We've built our virtual team. That's one of the benefits through the pandemic that we were able to do that. We teamed up with yoga centers, Pilates instructors, nutritionists, and yoga instructors. I said PRP and stem cell. I promote it. I see it work. I'm surprised how well it's been working. We're doing it for multiple years now. We're going to be able to pick that up also and start promoting it a lot more, just because of the new doctors here is going to free me up to be able to do more of that. So if you're interested in it, you want more information, it's on our website. If you want to come in for a consultation, you can also do that. Physical therapy and exercise, 100%. I mean, the pandemic, Trump being in the hospital, I heard a thing today, if you're older and you're overweight, you're more at risk. I mean, they're calling them a heavy, old, and fat, so we're not going to do that. The problem is that you need to relate to it. You need to create a preventative program. If you've learned anything from what we've done or our philosophy, it's more about prevention. I don't just solve your issue, I try to solve it and then create a preventative program. Modalities, the essential oil is big, the IV therapy is big, all these other things, the infrared light. We have a pretty good handle of what else is being done out there. Again, we're not just on Facebook anymore. We're on YouTube, we're on Instagram, we're on our email. Hopefully you're getting our email reminders. And if you can share it through your Facebook and all your friends, it just tries to build our presence, and hopefully you feel we're beneficial. So overall, the quote of the day, the scariest, the message is we want you to get started. Okay, so said by Stephen King, the scariest moment is always just before you start. So it is true in so many ways. I'm sure everybody's nodding their head right now that once you get into it, there's always solutions, there's always ways to do it. And to be honest, I guarantee you, if you follow what we're saying, in 6 weeks, in 3 months, in 6 months, you're going to feel like a whole different person. And I have a lot of patients that will give that testimonial to back it up. You just have to be the one motivated. I can only direct you, I can't make you do it. So shout out to my kids, who Paige's not at school anymore, but peace, love, and have a great